As this disc weakens, you start to see these annular fibers get stressed, stretched out, and they actually begin to tear. When those fibers start to tear, there's a chemical response that happens there, and you get inflammation and swelling. Your body basically only knows one mechanism when you have soft tissue damage. It protects you against infection. That's basically a survival mechanism. So there's a lot of inflammation and irritation that's happening there. There's basically like a chemical spill of irritation that's happening. As the tissue expands, this expanding tissue starts to put pressure on the surrounding very delicate nerve tissues in what's called the foramina. The foramina is this nerve hole that allows the nerve root to come out of the spine on either side. So here's the bird's eye view. Here's your spinal cord. Here are the nerve roots. Here is a ligament that wraps around the front called the anterior longitudinal ligament. Here's a posterior longitudinal ligament. And there's a patency here that allows the nerve root to exit the spine to feed your body. That patency or openness, or that open area, is a weakness. So, of course, stress always finds the road of least resistance, right? So the tissue starts to bulge posterior lateral. So here's the back. These are the bumps that you can feel when you feel down the spine. That's called the spinous process. This is the front. So your face is this way, your back is this way, if you guys can follow me on that. These are the bumps called the spinous process. When the disc starts to bulge, it goes posterior lateral either to the right or posterior lateral to the left. When the disc bulges like that, it puts pressure on and crowds these very vital nerves. Remember what your nerves do. Your nerves are carriers of information between your body and your brain. That information is what keeps you functioning. It's what keeps you healing. It's what keeps you alive. If there's any pressure on one of these nerves or on any nerve tissue, it changes the information that's going across the nerve. So if that nerve feeds your heart, what do you think happens to the heart? Not good, right? If that nerve goes to a muscle, what happens? Not good, right? If that nerve is feeding your foot and the muscles that keep your foot picking up as you take a step, for example, if anybody's ever seen anybody with drop foot, if that nerve is feeding, let's say, the tibialis anterior, which dorsiflexes your foot during your gait, if it's supposed to pick your foot up when you go to take a step and there's pressure on that nerve and the motor aspect of that nerve is affected, guess what? That muscle doesn't pick your toe up. So when you go to take a step, guess what? Your foot doesn't dorsiflex as you go through the swing phase of your gait, so your toe catches on the ground each time. All right? That's one of the families of functions of a nerve. It's not just sensory. That's the motor function of the nerve. So you may see that type of manifestation. You may see pain. You may see muscle wasting. You might see hair loss in a tissue, for example. I'll tell you what, personally, I've got a strip of hair loss on my leg. That's my leg, not my head, Bob. I got a strip of hair loss right here because I fell and I actually fractured my second sacrotubercle. I got such a bad subluxation of my sacrum, I cracked the thing open, and within a couple of weeks, the hair in the dermatome, that's the skin that's fed by that nerve, fell out. So I've got a stripe of no hair on that leg. And I've got a pretty hairy calf, so it stands right out. That's called a trophic change. So it's not just about how it felt or the pain that was generated from that. Those nerves have very important jobs to do. And it's because of the responsibility and the job of the nerve that it's so critical. We actually have a lot of sensitivity around that nerve tissue. Do you follow me? If we didn't have pain, we wouldn't have the warning that we have a problem and that there's something we have to do about it. So the pain serves you. And again, we'll talk about that today.
Hi, I'm Dr. Jesse Davis. I'm one of the chiropractors here at Franson Family Chiropractic. I hope that you enjoyed that video clip, and I want you to get the opportunity to see what our most successful patient cases have done to get their health back, to get their energy and their life back, to maintain it and also to increase it in the future. So what I want you to do, follow the link that you'll see here on the screen and on the side of the page. Fill in, when you follow that link, fill in your name, your email address. That way I can send you a link so you can see this whole presentation. So you can go ahead and do that now. I want you to enjoy the video.